Today we will study about the topic cellular events of inflammation. There are two events which happens during inflammation, the vascular events and cellular events. We will discuss about cellular events in detail today. We will understand about how the inflammatory cells reach the site of injury and carry out their functions. Under vascular events topic, we have to study about what are the changes which the blood vessels undergo at the site of injury. So first there is vasodilation, that is the blood vessels will dilate. Then there will be increase in the permeability of the blood vessels, which means that substances inside the blood vessels can easily pass out from the blood vessels. Substances such as cells and proteins can easily pass out from the blood vessels due to increased permeability. Then stasis or slowing down of blood flow occurs. As a result of the stasis, the normal axial blood flow is disturbed. So let's first understand about this normal axial blood flow. The normal axial blood flow consists of central zone and peripheral zone. Central zone consists of cells like red blood cells, white blood cells, including the neutrophils. These neutrophils are the predominant cells of acute inflammation. And there is peripheral zone which consists of plasma. We all know the components of the blood which are cells and plasma. So cells lies in the central stream and plasma lies in the peripheral stream. So due to when slowing down of blood flow occurs, according to Bernoulli's theorem, the central stream, that is consisting of cells, this central stream will widen and peripheral zone will become narrow. Also there is considerable loss of plasma during inflammation by exudation, leading to further narrowing of the peripheral stream. Now the cells will come closer to the endothelium. So leukocytes, that is the white blood cells, will now accumulate along the endothelium, and this process is termed as margination. After margination, the leukocytes, they move along the endothelium by turning over and over, similar to the wheels rolling over the road. This process is called as rolling. Then after the rolling stops, a bond is formed between the endothelium and the leukocytes, and this happens with the help of certain adhesion molecules, and we will discuss about these molecules in detail in our next chapter. And this bond formed between the leukocytes and the endothelium is transient or of short duration, and this process is called as adhesion. The endothelium becomes lined by these cells, and this process is similar to the pedestrians on a pavement, and this process is termed as pavementing. Next, the cells have to cross the endothelium to reach the site of injury. They will move into the space between endothelium and basement membrane. And to cross the basement membrane, there is secretion of collagenase which will degrade the basement membrane, as basement membrane is composed chiefly of collagen. Now the leukocytes will cross the basement membrane to reach the extravascular. Now they have to reach the site of injury. So how will they know where is that site? So to guide them, our body produces several chemical mediators or chemoattractants at the site. Some of the important chemotactic substances are leukotrienes, complement factors, and cytokines. Leukotrienes such as leukotriene B4, C3A, C5A. These are C3A and C5A are complement factors, and cytokines such as interleukin 8. These substances act as chemoattractant for the leukocytes. Since this process happens along the chemical gradient, it is called as chemotaxis. Now the leukocytes, chiefly neutrophils or predominant cells of acute inflammation, these are activated and will release lysozyme, and also oxidative burst will occur. And these two things, the lysozyme and the oxidative burst, have important role in the process of phagocytosis. And now these leukocytes will engulf the solid particulate matter, including foreign substances. Due to this, our body gets rid of injurious stimuli. We will study about this process of phagocytosis in upcoming lectures in detail.